For people that have an arm or a leg or a finger or some other portion of their body amputated, it's not uncommon for those people to feel as if they still have that limb or appendage or piece of their body intact. And typically, unfortunately, the sensation of that limb is not one of the limb being nice and relaxed and just there. The sensation is that the limb is experiencing pain or is contorted in the specific orientation that it was around the time of the injury. So if someone has a blunt force to the hand and they end up having their hand amputated, typically they will continue to feel pain in their phantom hand, which is pretty wild. And that's because the representation of that hand is still intact in the cortex, in the brain, and it's trying to balance its levels of activity. Normally, it's getting what's called proprioceptive feedback. Proprioception is just our knowledge of where our limbs are in space. It's an extremely important aspect of our somatosensory system. And there's no proprioceptive feedback, and so a lot of the circuits start to ramp up their levels of activity, and they become very conscious of the phantom limb. One of my colleagues was a guy, everyone just calls him by his last name, Ramachandran, who is famous for understanding this phantom limb phenomenon and developing a very simple but very powerful solution to it. And top-down modulation, the ability to use one's brain, cognition, and senses to control pain in the body, is something that everyone, not just people missing limbs or in chronic pain, could learn to benefit from, because it is a way to tap into our ability to use our mind to control perceptions of what's happening in our body. So what did Ramachandran do? Ramachandran had people who were missing a limb put their intact limb into a box that had mirrors in it, such that when they looked in the box and they moved their intact limb, the opposite limb, which was a reflection of the intact limb because they're missing the opposite limb, they would see it as if it was intact. And as they would move their intact limb, they would visualize with their eyes the limb that's in the place of the absent limb, so this is all by mirrors, moving around, and they would feel immediate relief from the phantom pain. And he would tell them, and they would direct their hand toward a orientation that felt comfortable to them. Then they would exit the mirror box. They would take their hand out, and they would feel as if the hand was now in its relaxed, normal position.